Okay, I think we're going to go ahead and get started this afternoon. There's just a couple more folks that are getting settled. But I just wanted to thank all of you for coming out this afternoon. I really appreciate you taking the time to come and listen about the changes that are going to be happening with the retiree complementary plan that you all have. For those of you who don't know me, I'm April King. I work here at PNNL. I've been here for just under 30 years. So some of you I know I've had the opportunity to work with, but some of you I did not. So again, I just thank you for coming. In front of you, you have cards and pens. As we go through this presentation, I encourage you to write down any questions that you might have. There is kind of a lot of material that we want to get through here this afternoon, and so it would be helpful, rather than asking questions as we go, to hold them to the end. But our intentions today is to make sure that you do not leave here with questions or concerns. We are committed to making sure that we answer all of the questions that you have and ensure that when you leave today that you're comfortable with this process going forward. So the agenda today really is to help you understand what is changing and why, how this is going to affect you. We're going to introduce a representative that we have here today from Extend Health. We'll talk a little bit about what's going on in the Medicare marketplace and go over the health reimbursement account that will be set up for you. And we'll go into a lot of detail about what that is and how that works. Then we'll definitely talk about what happens going forward, what are the next steps. And again, as I said earlier, we'll make sure that we answer all of your questions. So what's changing? Let's talk a little bit about your coverage. So effective July 1st of this year, the way in which you receive a Medicare complementary plan is going to be different. Right now you're in a group plan with PNNL with a prescription program. You also have a Delta dental plan, but currently through PNNL there is no vision plan. So as of July 1st, what will be different is you're going to go into a Medicare program through Extend Health, and there will be a health reimbursement account that will be set up for you. You have the option to work with Extend Health on a Delta dental plan if you choose. You don't have to. You can stay in the PNNL plan if you like. But they would have a plan that would be available for you as well. And they also, if you would like a vision plan, you can elect a vision plan through Extend Health. They can work with you on that as well. So those are the things that are changing. The way in which you pay your premiums will also be changing. Right now, most of you probably have your premium payments deducted either through your pension check or through this PayFlex program. As you go forward, as of July 1st, you will be paying the insurance companies directly. Now, again, you'll have what's called an HRA account that you will be able to use those dollars to pay those premiums. We're going to talk a little bit more later in the presentation today about the specifics for that. But your medical and prescription premiums, some co-pays, you can elect to use to pay those premiums. Now, the contributions that you're currently making to your healthcare costs, in addition to the HRA that PNNL will be contributing, should, for most of our retirees, cover the costs in an equivalent fashion that you're used to today. In addition, your eligible spouse will receive HRA funds. So you will both receive funds into a joint account that you'll be able to use going forward. The actual account. So for those retirees and spouses who retired before January 1st of 2005, an amount of $1,200 will be deposited into an account for you to use. That's for each, the retiree and the spouse. So a total of $2,400. If you retired after January 1st of 2005, at that point in time, PNNL changed the way they were contributing to the supplement medical payments. So you can see there's a prorated amount that is based on years of service. I don't know how many folks in here might fall into that category, but if you have questions about that, come and talk to us afterwards as well. We can check for you and see where you're going to fall in this. I would imagine most of you are going to fall within the $1,200 range. Now, based on the fact that we're making this transition mid-year, our typical plan years are January 1 to December 31st. But because we're making the change this year in July, those funds will be prorated on a 6-month basis. And so for this year, you'll see a $600 HRA for both you and your spouse. But beginning January 1 of 2014, you'll see the full $1,200. So if you or your spouse are not eligible yet for Medicare, so in those cases, you'll remain in the PNNL group plan, either you or your spouse. And at the point in time that you become eligible for this, Extend Health will in fact reach out a few months before that 65th birthday and will work with you to transition into this program. But if either of you are not currently eligible for Medicare, then you would continue to stay in the PNNL group plan. Now, one of the things I want to emphasize to you today is if you as a retiree choose not to participate either in the Extend Health plan or continue in our retiree medical plan, then your spouse or any eligible dependents are not eligible to be in this program. Now, that's really not unlike the current program that you have with your retiree medical. At the point in time that you choose to retire, if you didn't pick up the retiree medical, you could not come back into it at a later date, nor were your dependents eligible for it. So it's really not all that different than what you're currently seeing, but I want to continue to emphasize that so that you don't think you could not pick it up now but come back later. So you need to make sure that you make those decisions now. So why are we doing this? So I'm going to go to the bottom one first, because really, at the end of the day, there are definitely cost savings for Battelle. As Battelle looks at how they're managing their benefits programs and their benefits costs, they're always going to be looking at ways in which they can balance the needs of their staff, the needs of their retirees, and their costs and their liabilities going forward. So this, I wouldn't be honest if I didn't say that this was not going to be a cost savings for Battelle. It definitely is. Given a lot of the scenarios that they've also run for the retirees, it is highly likely that many of you, if not all of you, will also see some cost savings through this program. The other thing that's going on is that there's a lot of changes going on in the Medicare marketplace. There are a lot more options that are becoming available, and as we began to look at that, we realized that the PNNL plan that you all have is pretty much a one-size-fits-all plan. It is what it is, you get what you get. As you look at these individual programs, it really opens up a variety of options for both you and your spouse to take a look at what are your medical needs and how what's in the marketplace, how can that fit your needs, and you really begin to tailor your programs in order to best fit your particular situations. We also worked with Extend Health. Extend Health is probably the largest organization in the country right now that works in this field. We felt very confident with what they could bring to PNNL and to Battelle in this specific area. They are, in fact, an industry leader. They've been working with Medicare-eligible retirees since 2004, and as Colin will begin to tell you, worked with a number of Fortune 500 companies. They've also worked with a number of national laboratories. I personally spoke to HR directors at Oak Ridge, at Sandia, at Lawrence Livermore, all who had transitioned to this Extend Health program for their retirees. They were very, very happy with how those programs were operating for their retirees, and felt that their retirees were very pleased with the program. They will personally support you with a licensed benefits advisor. And again, Colin will talk to you much, much more about this and what you can expect from that. But you will get personalized support, and they will walk you through and make sure that you understand what you're signing up for. They currently partner with a number of the leading insurance companies, so we felt that the choices that they were going to be able to offer you were probably the most robust that we could find. They've helped, as I said, thousands of Medicare-eligible retirees through this process, so they know what they're doing. And they have a lot of tools that can assist you. So, and it doesn't stop once you enroll between now and the end of June. They will continue to work with you as things change with your medical needs and make sure that you have the information and the kind of support that is appropriate going forward. So again, I just want to emphasize how this really affects you. The Battelle group coverage that you are currently enrolled in is going to end on June 30th. You do need to call and enroll with Extend Health in a new program. There is not sort of an automatic transition from a Battelle program into an Extend Health program if you do nothing. You actually do need to take action and do something as a part of this process, because we will not automatically transition you into something else. So you do need to select and enroll. And I encourage you to call Extend Health early, call them as often as you need to, make sure that you are comfortable with the information that you're getting and that you have all of your questions answered. But don't wait until the last week of June to decide, oh, maybe I better do this. I would encourage you to do it early and make sure that you give yourself enough time to work through all of your questions. Your Medicare eligible spouse and or dependents also need to enroll, and it's a separate enrollment. Now that doesn't mean that you need to call during separate times. You can make the same phone call, but you're both going to need to go through an enrollment process. And again, we'll talk a little bit in more detail when Colin's up here about what that looks like. But be prepared to probably be on the phone for a fairly significant amount of time. It does take a while to go through all of that, and you want to make sure that both you and your spouse get enrolled in the programs that you need. So really, at the end, sort of the key messages that I want you to take away today is that, again, what you are going to pay for this will really depend on the kind of program that you choose, and it will be very tailored to fit your specific needs. You will have a health reimbursement account provided to you by Battelle to help you pay for some of the premiums or co-pays and things like that. You will work specifically with an Extend Health benefits advisor, and they will walk you through the process, and they will help you get signed up. They will help you establish the HRA, and they'll talk with you about how that's going to work for you. And then they'll provide sort of the ongoing support around, the personalized coverages, premiums, co-pays, deductibles, everything that you need to know. They will be able to share that information with you. And be confident that they will work with you to the point where you're comfortable and you don't have questions or concerns. So finally, the last thing is after today's presentation, and again, we're here, we'll stay as late as you need to answer your questions and make sure you're comfortable. But then I want you to make sure that you make those calls, talk to Extend Health, learn about the coverage, continue to ask questions again until you're comfortable and confident that you're making appropriate choices, and then enroll between now and June 30th, and then also with your spouse and any eligible dependents that you might have. And so with that, I am going to turn it over to Colin, who is our Extend Health benefits advisor. He'll provide a lot more detail for you.
Thanks, April. Good afternoon, everyone. My name is Colin McLennan, and I am a benefit advisor at Extend Health. I am in my 4th season at Extend Health and came up from Salt Lake on Wednesday to help all the retirees at PNNL walk through this and have an idea of what's going on with this move and with this transition. By a show of hands, how many people are worried about what's going on today? Is there anyone that's not worried? Okay, fair enough. Great.
That's because I do all of it.
That's because you do all of it. Right, fair enough. I shouldn't have asked. Who's Extend Health? So my company, Extend Health, is an independent company, and essentially what we've done is over the last 8 years, since 2004, we have partnered with over 80 different nationally and regionally recognized insurance carriers. So these are insurance carriers you know and are familiar with, like AARP, Aetna, Humana, Cigna. Companies like that. We've taken all of their individual Medicare products, things like Medicare Supplement or Medigap plans, Medicare Advantage plans, and Part D drug plans. We brought them into one single space that retirees can access those plans. What we do is we pair you, the retiree, with a benefit advisor like myself. We have a very down-to-earth discussion about what's important to you in a healthcare plan. Then using these insurance carriers we have on our platform, we help you select an individual product, an individual Medicare plan beginning July 1st, that begins for you July 1st, 2013. Of course, our services are no cost to you. We started doing these transitions in 2004, and we cut our teeth as a company with the big 3 automakers, Ford, GM, and Chrysler. Does anyone want to take a guess at how large of a retiree population GM has? It's large, 100,000 people. And there were people, some of the staff knows, because I've done this presentation a few times. But when GM came through and they transitioned to retirees, there were 100,000 people that we had to help, and we learned a lot of things that year. And every year since then, we've helped companies make this transition as well. So we work with currently 45 Fortune 500 companies. We have over 300 clients that we work with today. We've helped transition over 500,000 retirees through this process. So the companies you see up here, Caterpillar, FedEx, Volvo, Ford, Dole, Union Pacific, CSX, those are all companies that have trusted Extend Health with their retirees, just like Mattel, just like PNNL is doing today. Here's a snapshot of what some of the insurance carriers we work with look like. So ones that you're familiar with: Anthem, Blue Cross Blue Shield, AARP, Coventry, Humana, Cigna, Aetna, so on and so forth. So these are financially stable companies that are offering strong products that work for the individual Medicare population. Let's talk for a minute about my job as a benefit advisor. First and foremost is to educate retirees on what's going on. So at the end of June, your group health care plan from PNNL is going away. It no longer is going to exist. It's my job and my responsibility as a benefit advisor to help you find a new individual plan, whether it's a Medigap plan or a Medicare Advantage plan. That's going to be my job. I'm going to talk to you about the fundamental differences between Medicare supplement plans, also known as Medigap plans. I'll talk to you about Medicare Advantage plans, Part D drug plans. You and I will talk about that coverage gap or donut hole. You and I will get on the same page about your health care so that when we take a closer look at the options available, you know exactly what's going on. Which leads me to the second portion of my job, is evaluation and enrollment. This is an important piece. You and I have to have a discussion about your health care. I'm going to ask you what you like about your current group health care plan and what you don't like. I'm going to talk to you about bad experiences you've had with insurance companies in the past. I'm going to talk to you about how many doctors you're seeing, how often you're traveling, what medications you're taking. All of those types of things give me an idea of what is going to work best for you individually in this individual market. And we're going to come to a decision. I'll have a conversation with the retiree, and we'll come to a decision. He'll understand, or you'll understand how the plan works. There'll be no question about how doctor's office visits works or hospital visits and how they work. And my next job as a benefit advisor is to help you enroll electronically in the new policy. You don't have to fill anything out. You have to listen to a painful disclaimer, but there's nothing that you have to fill out and send back. You just get to listen for a second, and that's the brunt of it. These two boxes with education, evaluation, and enrollment are very easy things. I've worked with thousands of retirees. I'm a licensed health insurance agent in 43 states. I can take any person in this room, I can find out what's important to you in a health care plan, and I can help you find a new plan in the individual market. We have tools at our disposal that allow us to do that, and I know how to interact with people pretty well. What I can't do, and what we have no way of doing, is knowing what happens in the future. So I don't know what prescription medications you're going to take 6 months down the road. I don't know if your doctors are going to leave a network. I don't know if you're going to need surgery or whatever it might be. So my most important job as a benefit advisor and an advocate for you is to manage your health care moving forward. So if you have to take specialty drugs midway through the year, give us a phone call and let us know. If there's a solution, we'll help you through it. If a doctor leaves a network, if you have a question about a claim or your HRA, or you don't understand something, give us a phone call. Like April said, retiree health care is the only thing that Extend Health does. The enrollment guide. Did everyone get this? Anyone not get this? I saw a lot of you brought it with you. It's a great piece of information, but you don't necessarily need it. You can do whatever you want with it. The enrollment guide says this. It'll talk to you about basics for Medicare supplement plans, Medigap plans, or Medicare Advantage plans rather, Part D drug plans. It'll talk to you about very basic stuff for that. But I'd rather you just talk to an advisor and ask the questions that you need to ask and have that needs analysis done so that we can help you from that point. Has anyone in here used our web-based tool to enter in your information? Okay, great. So a handful of folks. Again, you don't need a computer or the process to work with Extend Health. You don't have to do this, but there are tools out there that allow you to enter in your drugs, enter in your red, white, and blue Medicare card information, and look at plans online. Some people like to do that. You absolutely do not have to. Here's what it looks like. If you plug in your information and then you go to and you use our website, it's going to show you different plan options that are available to you. It'll allow you to plug in prescription drugs, and it'll allow you to see definitively exactly how much money you're going to pay every single month. So it's pretty transparent. It allows you to judge how much money you're going to need for health care. The tools are well put together. This process, what we're talking about today, this transition from the group plan to these individual plans, is facilitated by a benefit advisor like myself. You're essentially going to have a conversation with someone that's a licensed health insurance agent. They're either in Salt Lake City, Utah, or in Richardson, Texas. We don't outsource any of our work outside this country. Okay. The average age of the benefit advisor is 43. They have to take a test to become a licensed health insurance agent, and it is not easy. After they've taken that exam, they have to become licensed in all the different states they're going to help retirees find plans in. They're going to have to become appointed with all the insurance carriers. They also have to go through a 6-week course that we call Extend University, where we teach our advisors the differences between Medicare supplement plans and Medicare Advantage plans. We teach our advisors about that donut hole and how to explain it to folks who have never had to deal with the donut hole before. We mimic things like cataracts so advisors know what it's like to come at this process like you do sometimes. We teach our advisors how to work with widows that might be 85 years old that have never had to make a change to their health care in the last 30 years. These are things that we contend with every day. The people in Salt Lake City and in Richardson, Texas, understand that Medicare is confusing, understand that the change is never any fun, and that people are worried and oftentimes losing sleep over this process. It's something we take seriously, and something that we train for seriously as well. Objective advocacy and neutral compensation go together. When I'm helping retirees select a plan, I don't get offered extra money offering one plan over another. Okay? I don't get offered extra money offering AARP over Blue Cross or vice versa. Okay? I'm an objective advocate for the retiree, and my job is to help you find the right plan that fits your individual needs. That allows you to keep seeing your same doctors. That allows you to go to the hospital networks you'd like to go to. So base salaries is the neutral compensation. We don't get offered extra money for putting you in one plan over another. The enrollment process takes place between a benefit advisor and a retiree and a spouse. The spouse can be on the phone at the same time. Everything is recorded. And we do ask that if you are making medical decisions for yourself, that you carry out this process. If you are making medical decisions for your spouse, make sure you do have power of attorney for that. The benefit advisor will ask. If you want to have a son or a daughter on the line as well, or a trusted advisor, a neighbor, whoever it might be, they are welcome to be on the phone too. Your red, white, and blue Medicare card. I hope everyone has this. If you don't, come talk to me afterwards. During the application process and during the process with the advisor, they will ask you for your health insurance claim number, your Part A and Part B effective dates, all that information. So if you don't have it, come talk to me. What's happening in July? In July, your group plan from PNNL is going away. It's no longer going to exist. It will be replaced by an individual plan we help you find through our exchange at Extend Health. Parts A and B of Medicare, original Medicare, Part A, covering hospitalization, and Part B, covering your doctor's office visits, remains the same. Nothing happens here. You keep paying your Part B premium. These are not impacted. Okay. Instead of having the group plan from PNNL, you are going to have an individual policy from Extend Health, and you essentially have one of two core options, or one of two core roads that you can go down. Your first would be to select what we call a Medicare Advantage plan. Medicare Advantage plans have your prescription drugs built in, and we'll take a closer look in a minute here. You might talk with your advisor, and he or she might say, this is not really a good fit for you. Let's take a look at the Medigap plan, also known as a Medicare supplement plan, along with a prescription drug plan. So these are your two core options. Medigap, along with the prescription drug plan, and then Medicare Advantage. The group dental plan that you have currently through Battelle, through PNNL, is going to continue on as it is. If you want to keep that plan, you don't have to do anything. But we all are going to offer you dental options in the individual market from Delta Dental. We're going to offer you vision plans as well, and we'll again take a closer look at those in a second here. A deeper dive on the core options we just talked about. Okay, the Medigap plans. If I help a retiree enroll in a Medigap plan, if she and I get on the phone and we decide the Medigap plan is a good fit for her, and she enrolls in that plan and she gets her cards, in July or August or September, anytime that she goes to the doctor or she goes to the hospital, Parts A and B of Medicare pay first. This Medigap plan will come in and fill in the gaps that original Medicare does not cover. Things like deductibles, co-insurance amounts, co-payment amounts. It fills in the gaps. The Medicare supplement plans, the Medigap plans, are not network-based. You can go and see any doctor or go to any hospital that accepts original Medicare. Okay, so if you're traveling frequently or you live somewhere else 6 months of the year, the Medigap plans are a good choice for you. They typically have a higher monthly plan premium and little to no out-of-pocket expenses. So you pay your premium for a Medigap type policy, and then you really don't have to worry with most of those plans with out-of-pocket expenses. We'll take a look at a specific example here in a minute. The Medigap plans do not include prescription drugs. So if we decide this is right for you, I'm going to find out what drugs you're taking and how often you're taking them. I'm going to find out what pharmacy you want to use, and I'm going to make a recommendation from our exchange of a prescription drug plan that covers your medications in the most cost-effective fashion. Again, you might say, this sounds great, Colin, but it's not for me. That's okay. You have your other core option, which are known as Medicare Advantage plans. Medicare Advantage plans are network-based plans. So if you and I decide that Medicare Advantage is the route that we want to go for you, I'm going to make sure that your doctors and your hospital networks accept the type of Medicare Advantage plan I'm going to recommend. I'm never going to help a retiree enroll in a Medicare Advantage plan and then expect you to find new doctors because they don't accept the plan that I help you enroll in. The Medicare Advantage plans are an all-in-one comprehensive plan, meaning your doctor's office visits, your hospital visits, and your prescription drugs are rolled into one comprehensive policy. They generally have a lower monthly plan premium, but you can expect with a Medicare Advantage plan to have out-of-pocket expenses when you go to the doctor or when you go to the hospital. For instance, maybe a $15 or $20 copay to see a primary care doctor, maybe a $30 copay to see a specialist. You might pay $250 for the first 5 days in the hospital. Something along those lines of the Medicare Advantage plan. Share cost. To backtrack for a second here, these Medigap plans or the Medicare Advantage plans, from what I understand, are absolutely going to blow the group plan you have out of the water. I understand that you have a $2,200 deductible, in essence, for the plan you've got now. So the Battelle plan doesn't pay until you've absorbed $2,200 in expenses for the year. That's a huge chunk of money. The one thing that is fundamentally different in the individual market that Extend Health represents, and it's going to be different, is how your drug plan works. Has anyone in here heard of the coverage gap or the donut hole? Okay? The coverage gap or donut hole is something that is involved in all the individual Part D drug plans, and I'm going to talk through how it works. I do not expect anyone here to even write any of this down. You don't have to leave with the knowledge of how this works. You don't have to know these numbers. This is the benefit advisor's job, is to find out what drugs you're taking and to tell you, and this is the screen that we see back here, will tell you, how much you're going to pay for your drugs every month. We'll tell you whether or not you're going to get into that coverage gap or donut hole and when. So there's complete transparency in the process. Let's talk about that coverage gap and donut hole. On July 10th, if I've helped her enroll in a Medigap policy along with a Part D drug plan, she's going to go and pick up her drugs at a pharmacy. Okay? In this initial coverage phase, when she first gets her plan, she's going to pay co-pays for her medications, much like she is right now. Maybe $7 to $10 for generics, potentially $20 to $40 for brand name drugs. Functions very similar to what you've got now. If the cost of her medications, or any of your medications for that matter, ever exceeds $2,970, you will have met the coverage gap or donut hole. In the coverage gap or donut hole, you will pay for 47.5% of your brand name drugs and 79% of the cost of your generics. If she's taking simvastatin, a generic medication, and we assume that the cost of simvastatin is $10, in that donut hole she'll pay for 79% of the cost of simvastatin, which would be $7.90. So you absorb more of the cost of your medications in the coverage gap or donut hole. Zocor, a brand name medication. If she's in the donut hole and she's taking Zocor, and we assume that Zocor is $100, she's going to pay for 47.5% of that medication, which is $47.50. You absorb more of the cost of your medications in the coverage gap or donut hole. However, you will know going in what it's going to look like for your particular situation during that year. It doesn't make it any easier. It doesn't alleviate any of the pain financially. I understand that. 60% of you will never leave this initial coverage phase, okay, meaning that you'll pay co-pays for the entire year. 40% of you will meet that coverage gap or donut hole and absorb more of the cost for a few months. Okay. Less than 5% of you will ever meet the catastrophic coverage phase, which says that you meet this phase when your out-of-pocket costs ever exceed $4,750. It's just protecting you against any additional financial loss due to prescription drugs. You pay $2.65 for generics in the catastrophic coverage phase and $6.60 for brand name medications. I hope no one wrote that down. It's something the benefit advisor will help you through. What's available in Benton County? Medicare Advantage plans. There are 5 unique Advantage plans offered by Extend Health in this county, from Humana, Assurance Northwest Health, which is a sister organization of Anthem, and the Group Health Cooperative. Remember, Medicare Advantage plans have your drugs built in. It's one comprehensive plan that we offer. Your other core option are those Medigap plans, offered by a variety of different companies that we would partner with a Part D drug plan. As a retiree, you're not going to have to go through 42 different options to figure out which plan is right for you. During the needs analysis phase, where I find out what's important to you, I find out how many doctors you're seeing and how often you're seeing those doctors, I'm going to have a very good idea of what I'm going to recommend to you. So if we get on the phone and you say, Colin, I see one doctor, and I go to the doctor once a year, and I haven't had a problem in 10 years, we're going to take a close look at Medicare Advantage plans. If you call me and say, Colin, I've got 8 doctors, I have to see every single one of them, I travel to Idaho frequently, and I had cancer last year, we're probably going to take a pretty close look at the Medigap Medicare supplement plans. Dental and vision. VSP is our vision provider. They offer a plan for $14 a month, which is $168 a year. It's just preventive type services, an eye exam, as well as lenses and frames. Things like glaucoma and cataracts, macular degeneration are all included under the medical policies. It's all taken care of for you. Dental is a $40 per month premium with a $50 deductible and a $1,000 annual maximum that they will pay. What I've done is I took one of these Medicare Advantage plans, one of the 5, and I looked at some of the basic stuff that's built into these Medicare Advantage plans. Remember, it's a network-based plan. This one in particular, one of the 5, is an HMO type policy. So I'm going to check and make sure your doctors accept this kind of plan before I help you enroll in this policy. It's a $57 a month premium with no deductible. You pay $57 a month for the plan. It begins to share costs with you instantaneously. It says that if you go to your primary care doctor, you have a $5 copay. If you go to the specialist, you have a $39 copay. The first 5 days in the hospital, you pay $295 per day. Days 6 through 90, you do not have a copay. I think the average stay in the hospital is around 3 to 4 days, so you're out before then. These plans cover all sorts of things. So skilled nursing facilities are covered, x-rays, blood testing, supplies, durable medical equipment, all of those things are built into these policies, but these are the main things I wanted to talk about today. You can see, again, that prescription drugs are built in. You have a $6 copay for generic medications, a $40 copay for brand name drugs, an $80 copay for non-preferred brand name drugs, and a 33% coinsurance for specialty medications. You might talk to your advisor and decide this is not for you. Your other option are these Medigap plans, and I've selected a Medigap Plan F, as in Frank. And I partnered it here with a prescription drug plan for a 70-year-old male. Here's what it says. You can go and see any doctor or go to any hospital you want to that accepts original Medicare. You pay $169 a month for a Medigap Plan F. Anytime that you go to the doctor or anytime that you go to the hospital, you have no deductible, you've got no co-payments, no co-insurance amounts. You don't get a check, or a bill rather, 6 weeks later asking you for money for services rendered in the hospital. You pay your premium up front, you have no out-of-pocket expenses later on. You're used to, right now, a $2,200 deductible. To give you an idea of what this might cost with a drug plan, I added in a $30 prescription drug plan that says there's no deductible on your drugs. You have a $0 copay for generic medications, a $35 copay for brand name drugs, a $70 copay for non-preferred brand name drugs, and a 33% co-insurance for specialty medications. So this Plan F, and these Medicare Advantage plans, again, are offered by these companies. So they're financially stable, well-recognized companies that offer powerful plans. How do I pay for this? Again, all of you are probably paying $83 for the group health care plan that PNNL is providing right now. They take $83 out of your check, out of your pension check, or $166 out of your pension check. That money is coming back to you in July of 2013. You are no longer paying for the group plan anymore. Okay, that money is coming back to you in your pension check. You don't pay for that group plan anymore. Additionally, PNNL is allocated $1,200 a year to the retiree and the spouse in the form of a health reimbursement account. So they set up this tax-advantaged account that they put money into. Instead of giving the money to you directly, which would be taxable, they put it in this tax-exempt account. And it's used to reimburse you for your qualified medical expenses. Now let's backtrack for a second here. If you're getting $83 back per person in your pension check, and you're getting $1,200 a year for your HRA, which is $100 a month, your total buying power is $183. For a 70-year-old male, it looks like you would probably every month absorb about $15 of premium payment. But do not forget, you have no deductibles and no co-insurance or co-payment amounts. So it begins to share with you automatically. You don't have to pay the Medicare deductible. There are no behind-the-scenes deductibles. There's no $2,200 anymore. This is going to end up saving a lot of people a significant amount of money. The HRA, to be eligible for this money, you must purchase a medical plan through Extend Health. So either a Medicare Advantage plan or a Medigap plan you have to purchase from Extend Health. There are going to be two ways to access this money. The first way, and we'll jump forward to it actually, is a paper claim where you pay your bills, you pay your co-payments at the doctor or the drugstore, and you write them down, you attach a receipt, and you send it to Extend Health, and we'll cut you a check out of your $1,200 every year to reimburse you, up to that $1,200. Kind of a pain. People don't like paperwork. It works fine. It's there if you want to use it. The second option is this, and then we'll go back to this slide. So remember that PNNL has put this money into an HRA account. You are going to be working with a benefit advisor like myself to help find a new plan, whether it's a Medigap plan or a Medicare Advantage plan. During the application process, which all you have to do is listen, I'm going to ask you, do you want to set this up for automatic reimbursement? And you'll go, yes, I want to set this up for automatic reimbursement. So automatic reimbursement says this. You pay your premium for your Medicare supplement, your Medigap plan, or your drug plan, or your Medicare Advantage plan. You pay that directly to the carrier. I will help set that up for you. I will facilitate that for you. You don't need to do anything on your own. you pay directly to the insurance carrier. Extend Health, my company, behind the scenes, verifies that you're paying your premiums every month. Once we do that, we automatically just reimburse you back into your bank account from your HRA. There's no paperwork, there's no phone calls you have to make. You just keep paying your premium. Behind the scenes, we'll reimburse you up to $1,200 every year. Okay, so you're getting money back in your pension check. You have this HRA that's going to help offset the cost, and in the example of the Plan F, you have no deductibles whatsoever. That's what the claim form looks like. This claim form, you will need to use it for your co-payments for prescription drugs. So you'll probably, once a month or once a quarter or maybe even once a year, you'll submit a paper claim form or two to be reimbursed on. You'll get a kit from Extend Health towards the end of June that says, here's a claim form, here's how much money you have to spend, here's what you can spend that money on, essentially. The HRA can be used towards medical or prescription drug premiums, medical or prescription drug co-payments. It cannot be used for dental or vision expenses, and it cannot be used to reimburse you for your Part B, as in boy, Medicare premium. A few things on auto reimbursement. The first is that it's not available on all plans. Most of them, I think it's about 95% of the plans we offer is available on. And sometimes the first payment takes a while to load in our system and get paid to you, but after that it's a pretty smooth process. A few things before I answer questions. The first is this. It does not matter what pre-existing conditions you have. Because your group plan from Battelle, from PNNL, is going away, you are guaranteed into the plans that we're talking about today. You're guaranteed into Medicare Supplement Medigap plans. You're guaranteed into Medicare Advantage plans. They can't rate you up. They can't deny you. They can't rate you up 6 months down the road because you end up having cancer. So don't worry about that. Pre-existing conditions have no impact here. The final thing that we're going to talk about is the ongoing advocacy that Extend Health provides. So if there are questions or concerns that come up throughout the year about specialty drugs, about doctor's office problems, claims issues, whatever it is, we are your primary point of contact. Okay, call Extend Health. Every year we're going to proactively reach out to you and say, hey, are you happy with your prescription drug plan or the way that your benefits are working? And people will always, take a look and make sure they still have the best deal that's out there. A few things to end on before we take questions. Every year, you can switch from the drug plan that you select, whether it's whatever drug plan it is. You can switch from that drug plan during Medicare's open enrollment season, which is October 15th to December 7th. You can switch your drug plan, no problem. You can switch Medicare Advantage plans, no problem. You can switch from a Medigap plan to a Medicare Advantage plan, no problem. However, you cannot switch from a Medicare Advantage plan to a Medigap plan in subsequent years without going through medical underwriting. So this is one of the few times that you are guaranteed issuing to these Medigap policies, and it's partially because they're very popular, they're very robust, they pay well, and they just work well. So drug plan to drug plan, no problem. Medicare Advantage plan to Medicare Advantage plan, no problem. Medigap to Medicare Advantage, no problem. However, if you select a Medicare Advantage plan this year, and you want to change to a Medigap plan in subsequent years, you will have to go through medical underwriting, which we'll walk you through, we'll take you through that, but there is a possibility of being rated up in that case. I would love to start taking questions. If we can pass them to this side, actually, to Cheryl's side, over here, that would be great. And then I'll start taking questions from the audience as well. Sir?
Would you repeat what the auto reimbursement program cannot be used for again, please?
Automatic reimbursement. Your HRA can be used for Medical premiums and drug premiums can be used for co-payments to the doctor or co-payments to pick up drugs. Your HRA cannot be used for dental and vision or Part B premiums. Other questions? Go ahead, sir.
So that I was going to ask, what if we didn't use the $1,200? But if it can be used for premiums, you're going to use it then.
Well, this I've forgotten every time, but the HRA, if there are unused funds, if you say the Medicare Advantage is fine for me and you pay $57 a month and you don't use it, all of your funds will roll over to the next year. And a husband and wife, it's a joint account. So if you need to dip into the other side, either way, it's just fine. Good question. I've forgotten every single time.
One other one. On the prescription drugs, the figures you're quoting are for 30-day or 90-day?
30 days.
And do any of these plans offer mail-in the 90-day?
Most of them will offer 90-day mail order supply, and some of them also offer you the opportunity to get a 90-day supply through retail, at a retail pharmacy. Okay. Is there a deductible? So, let's see. With the plans that we're offering, for in this case, a Medicare Advantage plan, there's no deductible. You don't have to meet the deductibles that A and B of Medicare have in this case. And the Medigap plans, there's no deductible either. So it covers you immediately. There's no $2,200 deductible. Will Obamacare change any of these plans? The answer is it's not going to. There were small changes to how certain things worked, a few years ago, but the Affordable Health Care Act is right now having a bigger impact on populations that are not 65. So no, there's no substantial impact there. Okay, other companies received $1,800 when their insurance was changed. Why is Battelle only $1,200? I imagine it has a lot to do with the fact that the $1,200 is probably what they were paying previously into your group plans, and they're just giving you that money in the individual market. I'm aware of the other company out here that transitioned a few years back, and you're right, they got $1,800. But I think we took a pretty close look. $1,200 is more than sufficient to cover a Medigap Plan F. We travel overseas. Can Medicare Advantage cover this? It will, depending on your plan. So the advisor will walk through exactly your international coverage for Medicare Advantage. This card just says Obamacare. Come talk to me afterwards. Will the dental insurance change? It will not. Coverage or cost? So there's
right now.
it says only one AARP gap plan, and the answer is no. AARP, which is United Healthcare, will have a variety of different Medigap options you can choose from. And so will Humana and Sterling Health.
On your webpage, though, there's some discrepancy on
So
display.
the question is, why am I not seeing this? So we have a certain contract with AARP that says we can't show their plans online. We're going to be able to offer them to you, but for whatever reason, and I have no idea, that they were not allowed to show them online.
If the next question on there is, you just had a slide that said there's 20 on one line, it's 11. So is that?
I use it for my system, so it's more accurate than what you can see online. So there's going to be 20 plans available. I'll say.
If we don't see those on the web plan or on the page that we're going out to walk through, how do we know?
The benefit advisor will walk you through all of that. So for instance, so we can't put AARP's plans on our website. Humana's plans and Sterling's plans, Medigap plans, are exactly the same. A Plan F from Sterling is the same plan as the Plan F from AARP is the same Plan F from Humana. It's just for whatever reason that they won't let us put them on the website. With respect to Colony Extend Health, do you have a sufficient number of advisors? Will significant time be spent waiting for an advisor? Average call wait, including time on last Monday for PNNL retirees, was 52 seconds. Including Monday, which is our busiest day. And part of the reason that this is going to work well is because it's July, and most companies are making this transition for January, so that you're going to have there are plenty of advisors, plenty of people in Salt Lake I work with that are looking forward to taking care of you. Medicare Advantage is single premium. Is Medigap plus Part D a single premium or two premiums? It's really two premiums that you pay for Medigap and Part D drug. Are the prescription drug plan costs based on 30-day supplies, what was shown? Are drug costs mentioned for 3 months supply or 1 month? So again, it was 1 month shown up there. The mail order 90 days is showing down here as well for you. How does Extend Health make their money? It's a fair question. Of course, it's a fair question. So again, the advisors are salary-based. However, when we enroll a retiree in a plan, we do get a commission behind the scenes that I have no idea what it is. That there are very few people in our organization that have any idea what it is, and absolutely the benefit advisors don't know. How long will current PNNL dental be available to retirees?
At this point, indefinitely, and it's available.
And how do we pay for that?
You can still pay for it as a deduction out of your pension check. You pay $45 or $46 a month each, right? So if it's two, you're paying about $90, I think, coming out of your pension check. Yep.
Let's see. Can we sign up for vision coverage at a later date? Yes, you can. Vision and dental, you can do it at any time of the year.
Related to the dental coverage,
Yes,
are the benefits the same
Pretty close.
through PNNL vis-a-vis going through Extend Health?
Pretty close.
Yeah, they are very close. But if you want to drop your PNNL dental plan, you need to write us a letter and let us know. We're not going to automatically drop that for you. So make sure that you let us know if you no longer want to carry the PNNL dental plan.
The question is, define skilled nursing. So oftentimes, if someone has a 3-day or longer stay in a hospital, a doctor will move them to a skilled nursing facility for rehabilitation purposes. It's not like an assisted living home, though. Are we assigned an advisor, or I'm not sure what that last part is.
That was my question.
What was the last part here?
Are we assigned an advisor, or do we get a different person every time we call?
So when you call in and talk to Extend Health, it's going to take you to an advisor that's licensed to help you in the state of Washington. You're going to work with him or her. And then when you call back in, if you call back in, you're going to be routed to that same person the next time as well. That's the way our system works. If they're on the phone, you can always ask whoever you speak to, just have Jim call me back, or just have, Donna call me back, whoever it is you're talking to. We want you to work with the same person, that's fine. But it doesn't matter either way to them. Are people having trouble getting on website? Does anyone here have trouble?
Yeah, I just tried today, and if you use a Google search, it will lead you to a list. And your website is not even on the list.
So when you're going to your browser, are you putting www.in, or are you just putting
I tried
extendhealth.com?
it both ways. In fact, I called one of your people, and we sat there for half an hour. I
Nice.
didn't use Google.
Let's take a look when we're done.
Question.
I was on it yesterday. I got on it yesterday from the lab. Yes, sir.
I get timed out repeatedly, and then I get frozen out until I close my browser down and then basically start from scratch.
I get timed out or frozen out. So this is good feedback.
Both. I get both. I get timed out, and then I can kind of log back in, type in my password, etc., and then I'll get back, I can work, and then what happens, I'll get timed out and locked out. I can't get anywhere.
So this is the first I've heard of it, and I'll send a note when we're done.
I've talked to them, and they just say that it's Firefox.
That's
I don't-
Firefox. That's just passing the button. That's what it is. I'll take a look and see what's going on. How many retirees does PNNL currently provide health insurance to? That's 1,536 Medicare eligible folks, 24 that have dropped coverage previously. Is Extend Health nonprofit? No. So we get paid again for the commissions from the insurance companies. There have got to be more questions. Oh. Oh, you're just fine. So it says, how do I tell whether a gap or advantage? The benefit advisors will help you decide whether the Medicare supplement, those Medigap plans, or the advantage is a better fit for you. If this is your...
No, on this one says PPO, and I just found out today that means that this is an advantage plan, right?
Correct.
So how do I choose if I want to see this before I talk to them that day?
Well,
How do I make it? So the PDP, no, what is, it doesn't show on the paperwork, it shows a PPO with an advantage plan.
right, so a Medicare Advantage plan is...
What is a Medigap? What's the alphabet soup for the Medigap?
So again, there are two basic core plans, and this is okay. Medicare is confusing. I understand. Don't be ashamed or anything. So Medicare Advantage plans are going to fall into two categories. You're going to have a PPO type plan or an HMO type plan. That's what dictates it being a Medicare Advantage policy. Okay, you might say this is great. You might say this doesn't work for me. That's one. That they're network based. Your doctors have to accept those plans in order to allow those kinds of plans. Okay. Your other option are Medigap. They are not network based. Any doctor or hospital that accepts original Medicare.
But how do I tell by your alphabet soup on here?
That's a Medigap plan. Come sit with me afterwards and I'll show you exactly. I can't see that from here.
Well, I know what an HMO
I can barely
is,
see my
but
hand.
this says PPO. And I think the intro said, I can find it again.
I'll come sit down with you afterwards. What other questions for the better of the group? Yes, ma'am.
We do actually. When both spouses, whatever, are both retirees past the magic 7-year mark, how does this work? Do we have to have two separate plans, or is there one and there's a primary, like in the old plan, there was a primary, and your wife was the primary and I was the secondary?
These are individual policies for your wife now, individual policy for you now. When you're 75, it's going to be an individual policy for you and an individual policy for her. It's not going to be a group plan anymore. It's all individual from here on out. Because you may not see the same doctor she does. You guys might take different medications. You might end up in the same types of plans. You might end up in a Humana Plan N or whatever it is together. Whatever is best for you, but that could potentially happen.
So they're totally separate.
Totally separate.
Now, is there any provision for durable medical equipment?
Yes, there is. Durable medical equipment is covered under both Medicare Advantage plans and Medicare Supplement plans. Ma'am, you've been patient.
Do I understand this correctly? If I'm in a Medigap plan, I'm staying on the old original Medicare plan, and that would be my primary insurance is Medicare. If I go on the Advantage plan, whichever plan I pick, Humana or whatever, that's my primary.
So it's a good question. If in this transition, if you select the Medicare Advantage plan, meaning the plan that combines it all into one, your doctors, your drugs, your hospital visits, all you pay co-pays for all that, that would function as your primary plan. And for all intents and purposes, it replaces your original Medicare. It doesn't. You don't lose your Medicare by any means, but it replaces it basically. Medicare Supplement, Medigap, synonymous. A and B pay first. The gap comes in and fills in all the blanks they're now paid for. So it coordinates with A and B. Other questions? Sir?
Generally speaking, what's the cost to me versus what I'm paying?
What's the cost savings to you compared with this from what you're paying today?
Right.
If I enroll you in a Plan F right now, well, not right now, but down the road, for July 1st, and you're what, 55? So let's say you're 70.
Thank you.
Okay, you're 80.
Keep going.
Let's say you're 90. Let's say you're 100 years old. You're not. But let's say that. So if someone's 100 years old, they say, "Colin, I need a Medigap Plan F. It's this robust coverage. It's going to work well." Just guessing on numbers, a Plan F for a 100-year-old might be $200 a month. $200, and you're going to pay an additional $29 for drugs. Okay, $229. You are also getting money back in your pension check, $83, and you're also getting an HRA of $100 a month. Okay, so if you are paying $230 for this new coverage, and between your pension check and your HRA, you get $183, so that's $17 plus, it's going to be about $47 that you absorb out of your pocket that's not covered by the pension, that's not covered by the HRA. So let's just say that you absorb $47 every month and it's painful. Do not forget, this is the most important thing, that you don't have any deductibles anymore. You don't have to absorb $2,200 before the plan pays anything. It's first dollar coverage at the hospital and at the doctor. Does that make sense?
But using roughly the same dollar coverage that I have now.
Right, with more robust plans, correct, that don't have deductibles like you have right now. Like I said, I've done this for thousands of retirees. We don't do this job perfectly, but people all the time come back and say this is typically a much better deal than what I had in the group plan. The individual market is enormous that we represent. There are 40 million people in it, probably more at this point, that share risk in this pool. Whereas with PNNL, you had just a little bit over 1,500 people that were sharing costs. So increases, even though you may not have known it, we're going up behind the scenes. Group plan increases for most companies in this country we're going through the roof. And they were going to either pass that on to you and make you absorb it, or give you a lower benefit plan as far as a group plan goes. And the alternative that works, that's been vetted by 45 Fortune 500 companies and over 500,000 retirees, is to use these individual products. I'm going to end here. I'm not going anywhere. I don't have anything else to do. I'm going to sit down, and I'm happy to talk with each of you individually. But I do appreciate everyone coming out on a Friday afternoon or evening, and I wish the best to all of you. Come chat with me.
Well, I do have kind of a
General question.
If I take Medigap and I get a new medical, my CVS Caremark prescriptions, are they moved too? I have to have a doctor write in.
You're going to have to have new prescriptions written. Yes, ma'am. So thanks again, everyone.
Thank you.